Pelvis hip spine dissociation is important in running, so let's look at the mechanics of that in a hip drive. Standing against the wall, I'm bending my knee to try to isolate knee flexion with hip flexion, keeping my pelvis neutral and my spine neutral, dissociating the femoral flexion and extension from the pelvis. It allows neutral knee, neutral foot, full access to glutes and hip flexors, full access to reflexive core without having to overwork to stabilize the spine. What happens if I stand in a posterior pelvic tilt? Now I am already in a little bit of hip extension. My femoral head is anterior in my socket on my right. I lose available range and more hip extension, less access to my glutes and hip flexors. Also might be harder for me to maintain neutral knee. I might externally rotate my knee. I will also have less access to my core. Let's look at anterior pelvic tilt. Now I'm in a little bit of hip flexion. It's harder to go further into hip flexion and have access to my hip flexors in this position. It also might be harder to control where my knee is going, and I may find that I am actually moving into more of a pronated or internal knee rotation. I'm also losing a little bit of that reflexive core because I'm not stacked. And then finally, let's look at what happens when there's associated hip flexion with pelvic hiking. Shorten the right side of my waist. I lose the ability of my core to stabilize. I lose the ability to generate full power from my hip flexors and my glutes because that pelvis is no longer stable and the femoral head is no longer centered in the socket. It's also harder for me to maintain my knee position as my knee tracks and adducts and internally rotates.